Since 2016, nearly 45,000 Canadians have chosen medical assistance in dying. And in the past couple of years, there's been a number of controversial news stories about sort of the expansion of this service, and some people feeling that it might be offered in cases where maybe it wasn't originally intended. Today, we're going to be talking about MAID in Canada, medical assistance in dying, how it's working, and maybe how that policy should change or should not change. But we're also going to be talking about the United States because they have a similar process. And so first we're going to talk about the United States, and joining me today is Bernadette Nunley. She's the National Director of Policy with an organization called Compassion and Choices. Bernadette, thank you very much for joining me today. I wonder if maybe for the Canadian audience who's not following the situation in the US, if you could just tell us a little bit about how medical assistance in dying evolved in your country.
Certainly, and thank you for having me today. So, medical aid in dying really came out of growing legal support that developed in the 1980s and the early 1990s in the United States. And the idea there was really support around individual self-determination and agency at the end of life. The first state that authorized medical aid in dying in the United States is Oregon, and that happened in 1994. And at the same time, there were immediate challenges to that law, which was actually passed through ballot initiative, which means it was an initiative that was that supporters led rather than through the legislature. The challenges really were around whether or not people should have a right to access medical aid in dying. And these challenges went all the way to the U.S. Supreme Court. And the U.S. Supreme Court really decided that dying patients can receive as much pain medication as necessary to obtain relief, even if that advances time of death. But they didn't find constitutional protection for medical aid in dying. And what they did say is, we're going to refer this issue to the states. So individual states then need to pass these laws or authorize these laws or allow the practice rather than the practice being available across the nation.
So I guess it differs state by state. Just if we look at the big picture, how many states in the U.S. currently offer this option?
Exactly. There are 10 states that allow the option, and then Washington, D.C. So 11 jurisdictions across the nation.
Okay, and if you look at those 11, what is sort of the scope of what is and isn't allowed?
Certainly. So in every jurisdiction, the same core criteria exist. So an individual who is seeking assistance at the end of life, the person must be terminally ill. They have to be mentally capable, which means that they can make decisions about their own health care. They have to be an adult, so 18 or older. They also have to have a prognosis of 6 months or less, which means that it's likely that they will die due to their terminal illness within 6 months. And then to access medical aid in dying, they make a request, in some cases 2 or more requests, to their doctor for the prescription. And then they also must be able to self-administer the medication that will lead to their peaceful death. And I think it's really important to note that all of the criteria, all of the process is completely voluntary for the individual who is requesting it, and then also for the healthcare providers who are engaged or decide not to be engaged in the process.
And so what is the American public's is there a general view in the US on this option? I mean, your nation is 20 years ahead of our country in terms of this. You mentioned 1994. Canadian patients just got this option as of 2016. So if you think big picture, are Americans largely on board with this, or any thoughts on that?
Certainly. We have recent polling is available that really says that most people are aligned with having the option, or the majority of people are supportive of people at the end of life being able to access the medication to die peacefully. And so that polling's available if you're interested in seeing it.
Okay. All right, well, listen, when we come back, I want to pick your brain a little bit more on this option, including what your advice would be for Canadian politicians.